people who have cardiac arrest outside of the hospital have a very poor chance of surviving intact. When they're my age, the chance becomes very, very small. I had an unexpected experience on January 9th. I went to Drayson, as usual. It was Monday morning, and went to my usual treadmill, which is the one along the outside wall. And I wasn't feeling up to par that day. I didn't know why. And when I started walking, I was just going very slow. I became acutely short of breath. And within a minute or two, I began to feel lightheaded. I intended to lean against the front of the machine to brace myself so I wouldn't fall. But that's the last thing I remember. What I learned from Terry, who was a retired captain at the Colton Fire Department, is I fell against the outside wall and slid backwards and landed on the floor. My head made quite a thud, and he was sure I had done damage to my neck. I had no pulse, I was not breathing, and my pupils were dilated, which is another way of saying I had died. A younger fireman by the name of George started chest compression immediately. And as I lay there, my first impression was chest compression is painful. And I had an inkling to tell him, you're pressing awfully hard. Maybe you could ease off a bit. But I realized I had no authority. Nobody was going to listen to me. So I didn't bother. I wasn't afraid of dying. I know where I'm going to go. I know who's going to greet me. So that's okay. By then, the ambulance people were there with their gurney. They drove off to the emergency department at Loma Linda University Medical Center. Caleb McKinney, now physician, who was a senior at the time, came by, take my history, and then he asked if he could pray for me. I thought that was beautiful. I really appreciated the prayer.
So I was in my ICU rotation of my 4th year, medical ICU rotation, and they said, medical student, why don't you go down and see the patient in the emergency room? And so I walked down to the emergency room, find the correct room that the patient is in, and start to have a conversation with him. Very nice gentleman, and I realized he's using really specific language to describe what happened to him, and I was like, this guy may be some sort of medical professional. And slowly but surely I realized this was kind of the famous Dr. Elder that had come to the medical school before. I had heard about his work at SAC Clinic, and kind of dawned on me who I was talking to.
I have been involved in teaching students to pray with patients for about 30 years.
And we had an amazing conversation right there in the busy emergency department about the spiritual battle that goes with a serious medical condition. It was a great opportunity to, hopefully witness to Dr. Elder. But I have to say it was an amazing experience to have someone like Dr. Elder to be the patient as I'm still learning these skills of whole person care.
I kept reminding the Lord that I was getting older. He needed somebody to come along and carry on that function because I saw it as very important. Well, praise his name, Amy Hayden took over and has been very effective.
I remember meeting Dr. Elder as a medical student, and he mentored me through my own desires to practice whole person care and specifically spiritual care. And we continue to meet today, every week, to talk about how we are teaching whole person care to students here at Loma Linda. Whole person care and spiritual care can also be prayer. Prayer is one of those things that really brings us to an even playing field with our patients, allows the presence of God into a space, and we find that can make such a difference with our relationships with patients and students and our community.
That night was a restless night. Caleb came by and would know how I was, how was the night, checked me out, and again asked if he could pray with me. And it was just beautiful.
And he offered to pray with me. as the medical student, as the so-called caregiver in that experience, and just shared to me that he was grateful that I had taken the risk to pray with him the day before, to talk with him about his feelings. And it really renewed my fervor, my excitement to work on whole person care. Don't hesitate. If you sense someone is looking for prayer, is looking for a little bit more, lean in, offer them an ear, offer them a prayer, give them a little bit more than just the medical treatment.